Hi, it's Chris Sepper. I am welcome everybody to another edition of MedHeads, MedCityNews.com's focus on the week in innovation in healthcare. As I said, I'm Chris Sepper. I run MedCityNews.com, and I am based in Cleveland. I'm joined by two MedCity journalists, Stephanie Baum, who covers early stage digital health innovation, who's based in Philly. Stephanie, how you doing?
I'm great. How about you, Chris?
I feel fantastic. And I'm also joined by Neil Vercel, who covers how healthcare is applying all these new technologies. He is based in Chicago. You can't see it, but he's wearing a Chicago Blackhawks jersey. Neil, how you doing?
Doing great. How are you, Chris? Well, you just told Stephanie, so I assume you're still great.
I am sad because of the Cleveland Cavaliers game last night.
Oh, yes.
That was intense.
Yes, but another day has come, right? So never give up. Hope springs eternal in places like Cleveland, Chicago, and Philadelphia, and the world. But we're gonna talk about healthcare innovation in the week that was, and both of you were in D.C. this week because of Health Datapalooza, right? The Lollapalooza of data, and so it gets bigger and bigger every year, right? It was part of HHS, now it's its own living, breathing thing. Neil and Stephanie, why don't you start and tell us what you thought was good about HDP this year?
Well, you know, believe it or not, this was my first Health Datapalooza. I know that's going to surprise a lot of people. I was kind of struck by how heavy it was still, even though it's a separate entity, how many of the sessions featured government people, although some featured former government people talking about a lot of things they did while they were in the government. Some were sort of pushing back from what's been done in government since they left, and I'm thinking in particular Farzad Masashari, former national coordinator, and Peter Levin, the former CTO of the VA. Both got to interview earlier this week. Stephanie?
This also was my first Health Datapalooza conference.
No way.
Yeah, way. And there were one thing that was a big theme this year, and probably has been building up to this, is how critical it is to develop better visualizations of data, or visualizations of data just generally. One of the things that the Health Data Consortium was pretty excited about is the launch of a challenge focusing on obesity, and basically encouraging entrepreneurs and healthcare professionals to come up with different approaches to visualizing patient data, with the idea that if people can see what they're doing, if people can see their performance, and it in context to you know, what happens when they drink something, or you know, their diet is good, or you know, they exercise more. If they can contextualize that data in better visualization tools, then they'll be more likely to understand, you know, sort of how, you know, one behavior, you know, impacts their overall health. So it seemed like a really sensible time for that kind of an approach. And I also saw that theme with entrepreneurs. I mean, one of the companies that I came across at Health Datapalooza is a company called Roadmap, and the co-founder is very much pro data visualization.
RWD, it's spelled, I believe.
That's right. That's right. And their whole thing is that 30% of medical expenses go to unnecessary care. I think that's it. And they actually employ a children's illustrator to visualize their data, and just as an illustration of how important visualization of data is to them, they have their business cards. Can you see that? They have illustrations on them. So that was definitely a big theme.
Thanks, Stephanie. Stephanie, can you show that card again?
Oh, sorry. Can you see that?
Yeah. Oh, yeah, yeah. Okay. So, all right. So you talked about that, a lot of data visualization. What was up with the fax machine thing, Neil? You started writing
Right.
about this, and I think Stephanie took umbrage. Can you break that down?
Sure. There were there was one session where a couple of people were talking. Oh, you know what it was? It was from the NHS in England. There was one of the speakers noted that the NHS is actually the largest user of fax machines in the world. And he was saying, he was actually asked, everybody in this panel was actually asked by Susan Denser of Robert Wood Johnson Foundation, formerly of Health Affairs and formerly of PBS, was asked what they would like to see 5 years from now, and he said, this was Tim Kelsey, who's the National Director for Patients and Information in the NHS. He wants to see the fax machine gone from healthcare by 2020. Karen DeSalvo, who was asked the same question, seized on the theme and said she would like to see more free data flow, no fax machines, and no clipboards 5 years from now. And I think everybody hates the clipboards that they're given when they walk into the doctor's office. Then, shortly after that, Farzad Mostashari, the outspoken one, was leading his kicking off his kicking off the Data Independence Day, which we can get to in a little bit. But he called for a bonfire of the faxes, I believe were his exact words, in healthcare. Basically, burn your fax machine, get rid of it. It's old technology.
And you love that idea.
I do, because fax is it's essentially a photocopy. I mean, fax means it's a telecopier. So it's a photocopy. The data is not computable, and I can't think of any other industry that uses fax machines like healthcare does anymore. Now in 2015 or even in 2010, everybody had pretty much gotten rid of their fax machines, with the exception maybe of the legal industry to get signed documents. But who still has a fax machine unless it came with their multifunction printer?
Well, the legal industry, we all can't be above the law. But Stephanie, is this a bit of a deal breaker for you? I mean, when you talk about fax machines?
That's some more convergence, because that's another breaking media title.
I just think it's oversimplifying.
I hope John's watching. So
it's just a huge oversimplification of the issue. I mean, yes, it would be great if we could throw out all our fax machines and bang zoom. The health industry is up to where it should be as deemed by the powers that be. But I just think it's an evolution, and it's a progression, and it's all very well to set goals, and a lot of them have been met. I mean, not a lot of them. I mean, if you look at the Direct project, for example, was a way of saying, okay, we acknowledge that most small practices, healthcare practices, can't really afford to go online with Epic or Cerner or one of these these market leaders in the electronic medical record arena. So the Direct project was a way of providing secure encrypted emails of patient information to, say, a pharmacy for e-prescribing. But it only really, it's kind of a lo-fi approach, because it only works from one source to another source. It's not, it's not as sophisticated as an electronic health record that could be seen by many people at the same time. So things like that have helped, but at the same time, it's going to take a while before these practices can get online. And for the idea to say, like, okay, well, by 2020 everybody has to be on this, or what happens then? Do they go out of business? I mean, there's been a lot of consolidation in the healthcare industry, but it's a terrible thing when practices have to close. Oh, I can see that I'm not impressing you.
Well, I would say this. I mean, I think. I mean, it's definitely gonna. I mean, if you're talking about making everything digital, I mean, that's really breaking gov, right? I mean, I think that you're really gonna have a challenge here in But in the end, I mean, isn't everything supposed to go digital at some point?
Right.
Because that means you can aggregate data better and you can do everything else. But you know, a doctor who's 97 years old is not going to cut the cord on a fax machine, and so we're never going to get that full interoperability.
I doubt a doctor knows how to use a fax machine at 97. It's usually the underlings that do that.
That's true.
Well, well, look, what's better, having a few independent practices or having everybody digitized so that patient records can be interoperable? Although I have to say, if we're looking for a blame for interoperability or for this issue of data, it isn't the fax machine, right? It's the big companies. I mean, dumping fax machines only makes the digital companies happy, and they're still not sharing, right? I mean,
Now, it's kind of important just to note who was speaking here. The NHS can mandate it. ONC here in the States cannot. So the NHS could say nobody's going to use a fax machine 5 years from now. They were just asked what they would like to see, kind of their goals. But the NHS did impose a universal patient identifier, and they did talk about that. Which, of course, we could go on for hours about the history of that in this country. We know it's not going to happen anytime soon, but we're just dealing with two completely different systems.
Well, let me ask this then. You know, listening to all the things you did at Health Datapalooza, and you talked about the fax machine thing because it was provocative, but like, what's the one thing as you listen to all the things that happened at Health Datapalooza, and this is for both of you, like, the provocative idea was dump the fax machines, right? What's the provocative idea that you would have inserted into this conversation to make something more meaningful and to advance, you know, the use of data in a more, I guess, what we're hearing is kind of more populist way?
Yeah. Well, the populist thing, that was Farzad's, because, you know, he was there to launch Data Independence Day, which goes back to the it kind of had its seeds right before the HIMSS conference, when CMS proposed lowering the threshold for patient engagement in stage 2 meaningful use from 5% to one single patient, and that set off the whole patient engagement community. Farzad kind of took the lead on that, but he kind of handed off the press interviews to other people, I guess, to show that he's not the only one involved in this. I mean, I talked to Christine Bechtel, who was the former vice president of the National Partnership for the National Partnership for Families and Children, and also to somebody who's involved in an open source data project that built a request form, an open source request form that they put up this week. So I mean, what they're trying to do is rally the troops in terms of showing that there is demand for patient access to their own records.
Yeah, I think, and much love to Paul Snyder, who's watching us online and who tweeted out, right? He succinctly put this together, like, why do fax machines still exist? Healthcare. I think also funeral homes, but healthcare as well. But Stephanie,
they're keeping the pager industry in business too. Healthcare is.
Stephanie, before we move on, what about you? I mean, what's your big idea or your movement forward when you looked at all the things talked about at Health Datapalooza?
Encouraged by if Neil already touched on this, then sorry, but the promise or the initiative by the CMS to release data on a quarterly basis, claims data. I think that will be a huge boon to entrepreneurs.
And also to open it up to the private sector for the first time.
Yeah, sure. And if they can keep to their timeline, then so much the better. I think Neil thought earlier that it might be a little bit overambitious, but maybe I'm wrong.
Yeah, well, they said that they're going to do the first quarterly release in August. In fact, they put up a slide showing the anticipated timetable. It was mid-August.
Do you think they'll seriously be able to...
Stephanie, stick with this a little bit. Like, I mean, what's this going to empower entrepreneurs? As entrepreneurs, why should they be excited about the announcement of claims data?
Because it puts everybody on the same footing. I mean, basically, they're getting access to the same information, and now they'll be able to... well, it'll give them an advantage they didn't have before, especially if they didn't have access to that data or didn't have an easy way of accessing it. It will basically make it easier to kind of see if their technology is is at the level that it needs to be effective.
So, Neil, are there other kinds of data that would be worthwhile for entrepreneurs to take a crack at and have a crack at that should be coming out, even if there's no plans?
Oh wow. Well, I think this is a huge one, the Medicare claims database, and they did say that there will be other data stores available, but that's kind of the big one. What else would they want? I don't know, because I'm not really sure what entrepreneurs are looking at. Maybe outcomes data from the VA or from the military health system would be interesting to study as well.
No, that's good. So now, I want to switch gears a little bit here. We talked about things that matter to entrepreneurs, and we talked about data visualization, and we talked about this kind of how do we force people into the future here when it comes to health data. I mean, Health Datapalooza itself is in a great evolution, as are the people and the players who are, going to have say over healthcare technology. Right? Susanna Fox, who has ascended into Health and Human Services recently. Right. She was there but didn't talk. She's just getting her footing. We hope to hear from her soon. But then you also had DJ Patil, who's the new chief data scientist. He did speak. What was both of your takes on what he said and what we can expect from him?
So I'm going to let Neil do the talking.
Actually, I missed his session. So, we got our work to do too, right? I'd be happy to discuss Todd Park, though.
I'm just going to break from a little behind the scenes. We actually had the DJ Patil question planned for MedHeads not 20 minutes ago, and they're both like, yeah, sure, we'll go after that DJ Patil question.
I was hoping...
You got nothing for sale! You got nothing, Bomb! What's going on? Oh, my God.
Okay, well...
Hey, let's talk Todd Park, because he's in a position of authority.
Yeah, he's in a position of authority. He's kind of the White House's tech representative in Silicon Valley now. He's the former CTO, and he said that he took the job pretty much at the request of the president, but he moved back to the West Coast to save his marriage, is what he said, and because his wife just needed to stay there for some reason. Todd made an interesting announcement. It's not brand new, but it's the first time I had heard of it, and I think the first time a lot of people at Health Datapalooza had heard about it. There is something out there called the U.S. Digital Service, which was created in October 2014, kind of built out of the wreckage of the healthcare.gov rollout, where they realized that the way they were building technology and managing technology was not up to the standard of the private sector, Silicon Valley in particular, but the tech industry in general. Todd Park called it DARPA meets the Peace Corps meets SEAL Team 6. And what they're trying to do is recruit 500 people to serve their country by the end of 2016 for about a year or two tours of duty. They have about 140 right now. Clearly, they can't match the salaries of the tech industry, particularly the venture-funded tech industry. But they're putting a lot of the people that they recruit into deploying them to healthcare projects. They helped support the relaunch of healthcare.gov, coordinated global worldwide data requests during the Ebola outbreak last year, and they've been working with the VA to improve IT services. Now the VA had that scandal regarding wait times and regarding sign up of registration of new veterans. So these supposedly elite core of tech people are, being used to improve how the federal government builds, manages technology, and ultimately serves taxpayers through technology. So I think there's a lot of synergy there with open data. How do you make this data? How do you free this data the way that people want to? And maybe back to Stephanie's point, maybe they'll be deployed to help get the CMS data release on time. I don't know that, but I'm just sort of guessing.
So Neil, translation is Todd Park has basically said the same stuff he says every year.
In some ways, yeah. I mean, data liberación has been his thing, and you know, that's the whole thing behind Health Datapalooza in the first place. And there are apparently other Datapaloozas in other sectors of the federal government. They've had an energy Datapalooza, I believe, an education Datapalooza, blah blah blah. But what's the thumbs down for?
Well, no, I mean, I have to say this. Another one from.
But I think this U.S. digital service is an interesting thing. It might be modeled after the.
Well, let me switch. I agree with you on the digital data service, Stephanie. Let's get you back in here. I mean, when you hear these things from Todd Park initiatives, I mean, he's in a different position now. He isn't an appointee. He's still very influential, and I think a lot of people look to him for data insights. But Stephanie, when you think about what Todd Park said or what's there, what do you think is going to evoke change? And is he? And I guess let's actually jump past all that. Is he really still the face of data liberation and the data movement in healthcare?
I mean, I haven't heard anything to the contrary. So, you might disagree with that. But I mean, I think.
No, I agree.
The elite team that he's talking about. I mean, I think it's a little bit over the top to describe them. What it's like, kind of like Navy SEALs.
SEAL Team, yeah, he said DARPA meets the Peace Corps meets SEAL Team 6.
Sure, but I mean, I certainly think that I mean, I've seen different health systems, particularly. I think I'm thinking of this. Maybe I'm thinking of the CDC. I hope I'm not getting something messed up. But what Boston Children's Hospital is doing with the CDC using data to better identify potential problems in the patient population, viruses that they need to be on the lookout for, and the fact that it's been applied to the Ebola outbreak. I mean, it seems like this is. These are useful applications. So, I mean, it sounds, I don't know, it's kind of like a very kind of muffled response. But it sounds interesting.
No, it's good. Well, I have to say I heard a lot of people who had a question mark about Health Datapalooza as a conference, right? Mm-hmm. It had real purpose and movement going forward, but what is it today? But from what I'm hearing from both of you, I mean, there still seem to be real actionable conversations happening at this conference that weren't happening other places, and I think, it sounds like there's still a lot of opportunities to move health data forward, and you're hearing a lot of it at HDP. Is that fair assessment?
One of the things Sorry, one of the things that I heard people say was they liked the fact that it was it wasn't really a corporate conference in the way that other corporations have taken over, or they feel like corporations have taken over conferences like the mHealth Summit and others. But it still was like there was definitely a fireside chat with like the head of Humana. So. Corporates are still there, and obviously CVS made a big announcement, it
actually ONC made the announcement on behalf of CMS or on behalf of CVS, and believe it or not, CVS returned my phone call, which has never happened before, because I was told by someone at ONC that they really wanted to get this news out, that they've they've been the first one to integrate to use an ONC or to use an HHS API to build. I'm blanking out now on the name of the site. The patient health data portal that you can get to through. Healthfinder.gov was it. Healthfinder.gov. It's a consumer site that has been up on the HHS, the HHS built, and they opened the API last year because I think people would rather go through a company that like CVS or some other company than go to a government website fearing the bureaucracy. And CVS was the first one to add it to its to add a portal to it with an API to its website. And they're on CVS.com and MinuteClinic.com. So it's kind of like a a bit of a symptom checker, a doc finder, and a patient education site all in one, and with a little bit of clinical decision support thrown in.
Yeah, and so I'll really be interested to see what happens with healthcare technology in the second half of the year. I mean, we're about a month away from wrapping up the big conferences when it comes to either health tech or health data, right? We've had HIMSS, we had CES, we had ATA, we had, and now we had Health Datapalooza. World Congress has a governance and data conference coming up in July. We have MedCity Engage, which is.
I was waiting for you to plug that. Well,
MedCity is. We actually. I won't announce it. We locked down our last keynote, another keynote from ONC that is going to talk and is going to uniquely discuss conferences. But after post Engage, it's less about everybody getting together to talk about health tech and patient engagement and patient empowerment, and it's really rubber meets the road. So I'm glad that this sounded like a great conference, but I'm also eager to see what the industry starts to do, and when we roll back into JP Morgan and CES and HIMSS next year in Q1, what, if anything, has really been advanced in that front. I want to wrap this up, and I wanted to ask both of you. I mean, Health Datapalooza was some of the big news this week, but was there anything else on MedCity News that really caught your eye as interesting news on innovation? And Stephanie, we'll start with you. Pick a story, any story.
Oh, she's muted.
Stephanie, you gotta mute yourself.
Sorry. Okay. What I thought was pretty interesting was Teva's move to invest in telemedicine. That is kind of the heart of this kind of stories that we like on MedCity News. This convergence of pharmaceutical and digital health. It'll be interesting to see what they make of that. I know. The pharmacy with this whole Beyond the Pill movement, there's been a lot of interest in using digital health technology as a way to make drug development more efficient, make clinical trials more affordable to develop. This could be one approach that gets a wider embrace. So I mean, Teva is obviously they're the largest generics manufacturer, I think, or they're definitely sort of in the top 5. So it'll be interesting to see how influential they are for other companies investing in this area.
Yeah. Well, on that sense, I think it may not be the signal of a trend, because the Schoenberg brothers, who founded and run American Well, are buddies with some of the Teva executives.
Sure. So I think it's just a relationship issue.
It could be, yeah.
Well, I don't know. I mean, anything is greased. The skids are always greased with a good relationship, because then you've got personal trust. And I have to agree. When I looked, I mean, there were some great stories on MedCity this week, but I think that Megan Kashivan did a great piece on kind of the lay of the land and some of the neurospace. But I think that Teva American Well deal is a really interesting one. No matter how that deal came together, just for the reasons that Stephanie said, fascinating.
It is.
Well, we have, for the first time in I think a few episodes, run our required and stoppage moment at 1:30. I want to thank Neil and Stephanie not only for just being on MedHeads, but heading out to Health Datapalooza to get the lay of the land. I want to thank all of you for listening again to MedHeads, and on behalf of Neil Vercel and Stephanie Baum, I'm Chris Sepper from MedCity News, and hopefully we'll see you again next week. Take care, everybody.